was particularly badly hit by Ebola, and this is just a comparison with some of the other regions of West Africa. Sierra Leone was just second behind Liberia in the number of fatalities, and they lost an awful lot of professional health workers during the Ebola crisis as well. So there's an acute need to train up more health workers. Claire and her husband Alex, who are both doctors, went out after the Ebola crisis to volunteer, and what they found was that when they wanted to look up information in the hospital at McCaney, there was no way to look up information. There's no libraries, there were no books, there's no internet access, nobody had access to books at home. So the health professionals in the hospitals, if they needed information, they were relying on what they learnt at school, medical school, that might have been years or decades ago, or they were relying on very old, out-of-date materials. There was basically absolutely no access to reliable, up-to-date health information at all in the hospital, which is unthinkable. If you think about in the UK, every hospital has a library, a professional librarian, everybody has access to Medline, to all the resources that you need. Simply nothing in the hospitals in Sierra Leone. So Claire and Alex came back and started this charity in 2013, and this is the vision of the charity. And it's all about making, we have quite ambitious, we're not called Sierra Leone Health Libraries, we're called African Hospital Libraries, because why should it be restricted to Sierra Leone? The need is vast all across sub-Saharan Africa for this kind of work. At the moment we're only based in Sierra Leone, but it's still at the early stages. So this is our vision. It's to facilitate access to clear, relevant, up-to-date, life-saving health information for all clinicians, regardless of geographical location, reliable electricity supply or technology, because a lot of these places there is very patchy electricity supply and almost no internet provision. Even if people have mobile phones, they might only have an actual internet connection for a few minutes a day or something. So this is what we do. We make vital information accessible. So these are some of the rooms in the hospitals. What Claire and Alex did was they got the support of the hospital management in our initial hospital in McCaney to get a room that was formerly a nursing station converted to a library. So AHL have provided books and the staff to run the library and the furniture, and it's now making information accessible in ways that it wasn't before, which I'll come on to. We provide quality resources, so this is where the kind of resources that we get. In the absence of electronic information, we provide books, good old books, except they're not old books, they're new books. They're all up to date, and they're very good quality. We get a lot of them donated by Bookaid International, I'm sure many of you are aware of. We got funding from the BMA Information Fund, which enabled us to buy books that are context-specific books from Health Books International. We also had donations from Oxford University Press, who we work quite closely with, and also a certain amount of selected good quality second-hand books through the Oxford Book Transplant, which is a second-hand book donation programme. So those are the kind of resources we provide, and we make them accessible to hospital staff and healthcare students in various locations. Now, when I came and talked to you last year, we had two libraries. We had the McCaney Government Hospital, which was our first one, that's this one, isn't it? And Bow, which is over there. And then just after I came and spoke to you last year, we opened our third hospital library at Kenema, which is this one here. Kenema was particularly hard hit by Ebola. The Kenema Hospital is the local Lassa fever centre. And when Ebola initially broke out, people weren't really sure what it was. A lot of cases went to Kenema. It was thought to be Lassa fever. A lot of lives were lost as a result of that. And you can see this memorial stone here to the health workers whose lives were lost during the Ebola crisis, just to give you a bit of background and a bit of context. We also have two other locations now, which Claire is going to tell you more about in a minute. So these are the places where we make our resources available. So we don't have any staff in the UK at all. All of the admin activity is undertaken by the trustees, the 5 trustees of the charity based in the UK. So the staff that we employ are all in country. This is Fatmata, who's our original library administrator at the McCaney Hospital Library. She's recently been joined by our newest member of staff, Edward here, as her library assistant, which frees her up so she can go and travel around the country and train up staff in our newer locations. And she can do that without having to close the library, which is absolutely vital because Edward can deputise in her absence absence. This is Mr. Momo Komba. He's our coordinator. He oversees all of the operations of all of the libraries. And then we have Alex and Joel, who are our library administrators at Bow and Kenema. So it just gives you an idea of the range of our staff. And not only, it's another important aspect is not only our own staff, but the hospital staff, the hospital management and authorities. It's been absolutely vital that we've had their support all along and their buy-in. For instance, it transpired that there were some information resources in McCaney Hospital, but the hospital authorities were so afraid that these valuable, precious resources that had been donated by bodies such as WHO, that they would be stolen, that they locked them away in a cupboard and nobody had access to them. So they weren't any use to anyone. The people who needed that information couldn't access them, nobody knew about it. So when these libraries were up and running and we proved that our staff could manage the resources and books didn't go missing and weren't getting stolen, then the hospital authorities brought out these resources that they'd hidden away and put them into the libraries. So now even everything's accessible and as it should be, actually available to the staff who need them. As I said earlier, there's no internet. We don't really have computers. We've provided laptops to our staff for administration purposes, but we don't have any library systems or anything like that. So we use paper systems. So some of the older people here might remember the brown issue system. So that's what we use. That's what we use. Good old-fashioned. It works. Yeah, if you don't have internet or computers, go back to card indexes. It works. So those are the kind of systems we have. I'll show you more about. Obviously, we monitor everything very closely, so our staff compile things like membership data, borrowing data every month, and they submit it to us. That's one of the things that they use their laptops for, is to compile spreadsheets of all of that very important data. The trustees go out, about 2 trustees go out once a year on self-funded monitoring visits, and they undertake user surveys and interviews to gather evidence of how the systems are working. We also carry out staff appraisals and we support professional development of our staff. So, for instance, we're about to fund one of our library administrators to go on a computing course. So when we are able to provide computers, which we hope to do very soon, they'll know how to use them. All of our accounts and all of these case studies and reports and so on are available on our website. We'll give you the website at the end. So it's all quite transparent and you can see what we do. And the surveys and monitoring that we've carried out so far have given us a wealth of evidence to show that these libraries are really making a difference. They really are having an impact. There's a couple of quotations there, and you can see a lot more case studies and quotations on our website as well. And we've got a little video we might be able to show you at the end if there's time and if it works. So we found a wealth of evidence to show that the libraries are having an impact. There are health professionals who had never had access to this kind of information before and are now regularly using the library resources in their diagnosis, in their prescriptions and so on. We've had doctors who've said that they will always keep the textbook to hand to refer to, and that's quite a major change in the culture of the country, where previously it might be considered to show a lack of authority if you had to look something up. It might be shown a sign of weakness that you didn't actually know everything in your head. Whereas now we've managed to change that culture and people appreciate that you need the most recent information, and we're really proud that we've been able to have an impact on that. So when I came and spoke to you last year, September last year, these were the plans that we had for this year. And we were hoping to, because our little rooms that we have our libraries in have become much too small. They're so popular and they're so well used, they're much too small. This is a typical scene in, which library is that?
I wouldn't say it's typical, but
no,
it's
McCaney.
When the new students arrived, so there were so many that they actually were reading outside the library.
Yeah, I mean the rooms are really too small and they're not fit for purpose. They're not libraries, and so what we're planning to do is build resource centres. Actually, what's the word? Purpose-built resource centres that maybe even have computers in them, and more space and toilet facilities. Really important, especially with things like Ebola, washing facilities. So we're planning to fundraise and build those at McCaney and Bow. We have some other libraries that we were hoping to start up to employ a new member of staff and to provide computers. So I'm now going to hand over to Claire, who's going to tell you how far we got with all of that.
Thank you. Thanks, Stevie. And thanks again for having us. I'm Claire. Okay, so have these hopes been realised? Well, I'm happy to say that we're about to start building fairly soon our resource centre in McKinney, which is that the site that Stevie showed that photo. We're in the final administrative steps in Sierra Leone, and I was on the phone in fact today to our coordinator who's going to McKinney on Monday to sort out those things, and then we're hoping to start digging, which is great. We were hoping to try to assist with the setup of a library in Fourah Bay campus, and this is Fat Matter, our library administrator from McKinney at Fourah Bay, setting up the library. So we'll have some more news on that soon.
And that's the Fourah Bay campus of the University of Sierra Leone.
It is, in Freetown. And then the Olajuwon Children's Hospital and Princess Christian Maternity Hospital, we have been working on trying to, this is based in Freetown, these are the tertiary referral centres for paediatrics and obs and gynae in the country, and we've been working on the library there, which has taken a little bit of time to organise the logistics, but all of the books are currently in our house and are going soon, so that's great. We've been, through these two projects, we've been engaging more and more with COMAS, which is the College of Medicine and Allied Health Sciences at the University of Sierra Leone, and we've been linking up with their library services, which is fantastic. So we're hoping that we'll be able to work with them more and more over the coming months and years. We have, as Stevie's mentioned, we've employed Edward as the library assistant in McKinney, so that's great. And we've got 2 computers that have been donated to us that we're going to be loading lots of e-books onto and sending out for a pilot offline computer catalogue, if you like, of e-books in Bow. They'll all be going out with the Olajuwon books and more. So part of the I was in a presentation fairly recently. I can't remember whose it was, so I'm plagiarising completely. But they said that the last mile is the longest, or something like that, and it's completely true. So. The important thing is that the information is accessible to the health professionals that are treating the patients, and that they can use that to impact on patient care and improve the health of people. So that's the ultimate, where things ultimately should be aiming towards. So we know that part of that is to maintain and improve the quality of the library services. It's all very well setting something up, but actually is it working? So this is, Steve mentioned the kind of trustees' visits, and all of the monitoring data that we collect. This is Tracy, who's amazing, one of our trustees. We've all spent time in Sierra Leone, all of the trustees, and she is visiting Kenema, and there were some issues that needed to be improved in Kenema, but with some mentoring from Tracy and quality assurance visit, and then ongoing support and mentorship from the library administrator in Bow, with oversight from the in-country coordinator, he has turned it around, which is wonderful. We've also had sponsored runs and cycles and other sponsored events, which has been really important for us, which I'll come on to in a second. This is Fat Matter on the back of an Okada doing her leg of the sponsored event, which involved her travelling around by motorbike to libraries in McKinney as part of our fundraising efforts for the McKinney Resource Centre. We've joined Ahila, and we're hoping to engage with them more over the coming months. We've been building relationships both in the UK but also in Sierra Leone, and amazingly with the Ministry of Health, which is wonderful, because we really are trying to advocate for the importance of health information as part of the health service, because it's really difficult. Medicine changes all the time. You need to keep up to date. You can't remember everything, and you're having to treat patients. So it's very important to be able to access information that you need. This is our team working with the COMAS library staff, which is wonderful. And more. So since last year, when Stevie gave the presentation, then we've had people volunteer with us. So this isn't strictly 2019, but it was Christmas last year, so hopefully you'll forgive me for including this. But this is a particularly valuable volunteering session that we had. This is the group communications team at Oxford University Press, who very kindly volunteered half a day to basically give us their consultancy skills on communication, which is wonderful. And they even made these templates for us for the slides, and they've given us some really, really helpful advice about communication, which we're trying to implement as time goes by. And we've had, using their advice and using other volunteers, we've had 2 amazing volunteers who've upgraded our website, things like that. So we're trying to kind of improve in that way as well. We've had some health librarians from the UK that have mentored our library assistants, our library administrators over the past few years now, which has been a great learning experience, and we're trying to improve that too. And we've had increasing donations of books, which sometimes presents some challenges, but all in all, very, very good. So our challenges this past year, I'm sure you can imagine that there are quite a few. As Stevie mentioned, we don't have any paid staff in the UK, and we have 5 members of staff in Sierra Leone, which is great, and that's sort of the way it should be. We're trying to improve capacity in Sierra Leone, but that is a challenge at times. Funding, so we have fundraising is always a challenge for everybody. Particular to this year, the government quite brilliantly increased everybody's salaries in the public sector by a massive amount, which is wonderful. But we try to keep the salaries of our staff in Sierra Leone aligned with the hospital salaries, so that they're not distorted. So we try to make sure that they're paid on the same sort of scale the same scale in fact, as their colleagues in the hospitals. So that had quite a big impact on our expenditures, but that's the right thing, which is good. And equipment, so Stevie mentioned computers. We've even, one of our laptops has died, etc., etc. So there's various challenges on that side. We've become increasingly aware that Stevie is our only qualified librarian in the whole of AHL, and we're becoming increasingly aware that the limits of our professional knowledge and skills, and so we're hoping, I'll come on to that in the next slide, we're hoping to improve that. Communication, I spend a lot of time on WhatsApp. If people aren't familiar with WhatsApp, you should get it, it's amazing. You can have basically a phone conversation with somebody halfway across the world for free. So we spend a lot of time speaking in Creole on WhatsApp, which is great, but as you can imagine, there are challenges with communication from the UK to Sierra Leone, and sustainability I'll come on to in a minute. So our hopes for this coming year, we hope that the resource centre in McKenney will be finished. That would be amazing, because as you can see, it's really, really needed. We want to also fund a resource centre in Bow. Bow Hospital Library is much more it's much more used than McKenney Hospital Library. They're both in strategic places in that they're surrounded by lots of training institutions, etc. We think that McKenney really doesn't have the capacity to hold, there's only 4 chairs, for example, for people to actually read. So they were our priority. But Bow, even though they've got more space, is not enough, and they don't have toilets, etc. that Steve was mentioning. And it will give us space for computers, which would be great. We're hoping to be able to recruit and employ a professional librarian in Sierra Leone. This is one of our major hopes for this year, to try to be able to better support our existing staff to improve their skills and their capacity, in Sierra Leone, and to innovate in ways that are appropriate for the context, to be able to link up with the existing healthcare or the existing librarian professionals in the country and beyond in sub-Saharan Africa. And we think it will be, we hope that this will really, really help to really improve sustainability in the last slide of the whole thing. And they can advocate at ministry level, etc., which passes on to this. So we have started, and we're going to increase our advocacy for the value of health information, because for the Ministry of Health, not to, just to try and bring it into conversation about the value of people being able to look things up as they go about their work as a healthcare worker. We've got an inaugural staff annual general meeting happening in January, which our staff are extremely excited about, and that will feed into our trustees meeting, our trustees visit when we go in February. So this is trying to really, we really do work as a team, and this is trying to even strengthen that more. And we want to improve our ties and collaborations with librarians both in the UK and Africa.
That's you lot.
And as Stevie mentioned, we're really hoping that we will be able to get computers. But with computers, as Stevie mentioned, comes skills to be able to use the computers themselves, and then to use what is accessible via the computers, and to be able to critically appraise it, etc., and make it usable for people. So yes, that's another hope. So how you can help? Well, this is, I don't know if anybody knows Reese. He said I could use this as I wished, so I have. Anyway, so some people have run for us and things like that this year, and it seems like a small thing, but it's actually a really massive thing for us because we're small. Our expenditure isn't that massive, but it has increased. So all of these things are really, really helpful. So if you fancy getting on your bike, doing a run, having a cake sale, having a Christmas jumper, this is Stevie's, books on it, events, if anything like that appeals to you, then we would be extremely, extremely grateful. You can volunteer with us. Clearly you're our target audience of volunteers because you're subject experts and have huge amounts of experience. So all of our volunteers so far have been people either from OUP or people that we kind of know who've helped us out. If you have book suggestions, so we are, part of quality is making sure that we've got quality resources that are up to date and are the best things for the people that are using them. So if you have particular suggestions, including now ebooks, because we're going to branch out, then please do let us know. Our contact details are on the card or on the website. If you've got any books that you want to donate to us, then also please let us know. We try to take things, we have a cut-off of 10 years definitely, and if the incorrect malaria treatment is in the book, then we won't take it, things like that. There are some exceptions, like anatomy, doesn't change much. If you'd like to twin with a library, let us know. If you're interested in mentoring, let us know. So I think that's all. So, and I've plenty to think out, which is thank you all very much. And we'll be very happy to take any questions that anybody has. Thank you.
Thanks very much. Jamie's had to catch the last train to Wales before it closes, so I'm taking over.
Before Wales closes.
Yes, exactly. So, any questions for the children? Thanks very much for a good speech.